This lesson is on how to help a person who is choking. 70% of the time, you will be helping someone you know, either a friend or a family member. Sometimes people who choke, they will try to get away from people because they are a little embarrassed. So it's important that you follow this person in case she needs help. You want to identify yourself and let her know that you've been trained and you're going to help her. Ask bystanders to get a first aid kit, but at this point, there is no need to call 911. If she can cough, encourage her to cough and do nothing else. Coughing is the best way to clear a blocked airway. However, if she can no longer cough, that means her airway is completely blocked. And you know when she starts making this noise, okay, so when a person begins to cough, if they can cough it up, encourage them to cough. However, if they start to cough and the blockage becomes more severe, you're gonna hear that sound. That's when you start to take action. Because that noise means the airway is now completely blocked. The proper technique is 5 back blows followed by 5 abdominal thrusts, and keep repeating. The actor in this video is hitting too softly. In a real situation, you need to hit hard. Ask her to go see a doctor because she can potentially be injured by the abdominal thrusts. The next scenario is when a person chokes and becomes unconscious. Again, you do everything I taught you in the first scenario, including identify yourself, ask bystander to help, encourage the person to cough, and then the back blows and abdominal thrusts. However, if you cannot unblock her airway in about 3 minutes, she will become unconscious and collapse. So be prepared to catch her and gently lay her down on the ground. And in this case, you do need to call 911. Either ask bystanders to call 911 or bring out your cell phone and put it on speakerphone. On the average, it takes 8 minutes for the paramedics to arrive. You want to give 30 compressions at a rate of about 110 compressions per minute. And you want to compress about 5 to 6 centimeters deep. Look in the mouth and see if you dislodge any food. If there is food, scoop it out with your finger. Do a head tilt chin lift and give first breath. Look to see if the chest rises. If the chest does not rise, readjust the head by bringing it down and then bring it back up, give second breath. So the reason why you want to check to see if the chest rises is because that will determine if the airway has been unblocked or not. You're going to keep repeating this, 30 compressions. Look in the mouth, remove anything if you see any food, First breath, check to see if the chest rises. If not, readjust the head. Second breath. Now in this video, the actor starts breathing quite quickly. But just be prepared, in a real life situation, it's going to take a lot longer. So keep her comfortable until the paramedics arrive, and then record as much as you can remember and give to the paramedics when they arrive. In this scenario, you're trying to help someone who is pregnant. With a pregnant woman, you're going to do the chest thrust instead of the abdominal thrust because you don't want to injure the baby. Another reason why you would do the chest thrust instead of abdominal thrust is if you're unable to fully wrap your hands or your arm rather around a casualty's abdominal area. In this scenario, you're going to try to help yourself if you are choking. Make sure you make as much noise and attract as much attention as you can so that if you become unconscious, someone will be there to help you. Do the abdominal thrust on yourself by using the back of a chair, or if there's no chair, use the side of a table. Go see a doctor in case you injured yourself doing the abdominal thrusts.